Good day, everyone, and welcome to another screencast here in Methods of Health Research. I am Dr. Subhachay Basit, and for today, we will be discussing Introduction to Quantitative Research Design. So, in doing quantitative studies or for any research studies for that matter, planning consideration would be very important, meaning we have to evaluate the scientific merit of your research studies when it comes to reliability and, of course, validity. So, when we say reliability, of course, we are pertaining to the accuracy and the consistency of the data that we will be analyzing. And when we speak of validity, we are pertaining to the soundness of our data. So when we say soundness, it means that it is unbiased, cogent, and well-grounded. Meaning to say, if we're able to satisfy these considerations, then we have a quality of evidence in order for us to derive generalizations in our study. So when we say uh, evaluate the scientific merit, so we are actually concerned with this particular um, in this particular figure wherein the data that we are analyzing for our quantitative research will be both valid and reliable. So when we say generalizability, this is very important to quantitative studies, which means that it is the extent to which findings can be applied to other group or settings. Okay, so of course, quantitative studies would be more generalizable if we have a very ideal sample size. So let's talk about the internal validity versus the external validity. So what do we mean by internal validity and what do we mean by external validity? So when we say internal validity, internal validity refers to the degree of confidence that the causal relationship being tested is trustworthy and it is not influenced by other factors or variables. So, when we say internal validity as a researcher, we are sure that variable A, the effect of variable A is indeed caused by variable B, and and you are really sure of that particular causal relationship. Now, what's the difference between the internal validity and external validity? So when you say external validity, it refers to the extent to which results from a study can be applied or generalized to other situations, group, or events. So external validity may sometimes refer to um, ecological validity because the study that you did here in the Philippines, okay, may be applicable to a similar situation even if it is done outside this country. So that's another example, and there are many examples in which we can, of course, describe external validity. However, the major threat to truth would be bias. Okay, so what do we mean by bias? So bias refers to, of course, the lack of objectivity. Okay, so that's what we meant by bias, and there are many reasons why bias could possibly happen. For example, the participant's lack of candor, or the researcher himself is very subjective when it comes to dealing with the quantitative data that he's processing, sample imbalances, faulty methods of data collection, inadequate study design, and flawed implementation. So these are the major threat to truth. And in speaking of bias, there are two types of bias or error that you can actually get. So when you say error or bias, it can be either random or systematic. So a random error is also known as the variability or random variation or noise in the system. Okay, so the heterogeneity in the human population leads to relatively large random variation, especially during clinical trials. Okay, so that's something that's quite difficult to control. So that's the reason why, particularly if you're doing clinical trials, it is very important that we do the randomized controlled clinical trials, so that somehow we eliminate this particular type of bias. So a systematic error or a systematic bias refers to deviations that are not due to chance alone. Okay, so these are the major threat to truth, bias. So in order to prevent such bias, whenever you are doing quantitative study, it is very important that you include a research control. So you have a control population, for example, because research control will prevent contaminating extraneous or confounding variables. So these extraneous variables are not part of your dependent and independent variables, but they may still actually affect the outcome of your study. Okay, so how do we control or how do we prevent bias? So holding constant extraneous variables and matching is very important. So you have a matching population. For example, you have randomized the two groups, okay, into two groups. You have the experimental population, you have the control population, and then you match. So matching, okay, which by the way, in dealing with bias, it is impossible to control all. So, like what I told you, extraneous variables that do not affect both independent and dependent variables need not be controlled. So, those crucial extraneous variables that may affect the outcome of your studies should be the one to be prioritized in controlling them. Okay, so methods to prevent bias in quantitative studies should include by adding a research control, okay, by randomizing your population, so you do not pick which one goes to the control group, which one goes to the experimental group, by masking or blinding. Meaning to say, one of the most effective way of preventing bias is to do the double-blind studies. So when you say double-blind studies, the participants themselves do not know whether they are part of the experimental or control group, and of course, the researchers do not know which among the population belongs to control group or experimental group. So that's what you call masking or blinding. Okay, so masking or blinding, there are actually two types. Okay, so you have the open study, meaning no masking at all. Although I'm not saying that it's bad, because in some cases, it is actually required to do open masking. So I already explained what a double-blind study is, and then we also have the single-blind study, wherein either the researcher or the participants would be the only one to know whether they are part of the experimental or the control group. Okay, reflexivity is one way of preventing personal bias. So note, to say reflexivity, personal values, and self-reflection. So, I mean, this is a way in which a researcher can prevent being too much subjective. Although in qualitative study, researchers are really expected to be subjective, but somehow by having self-reflection, we may somehow minimize bias in qualitative studies. But of course, our main discussion here in this particular module would be quantitative studies. Okay, so there are different features of the research designs. So I think I discussed intervention, control a while ago, masking, okay, comparisons, location, and time frames. So we can, in quantitative research design, we can do comparison among two or more groups. So So yes, that is possible. So usually, if we're comparing two groups, two independent groups, we may use t-tests for independent samples. But if we're comparing only one group, but you're after with the before and after effect, then we may use the t-test for paired samples. But if you have more than two groups, then it's about time that you will be using one-way ANOVA or one-way analysis of variance. I think you will learn more of these during your biostatistics class. Okay, so here, this is the one that I've told you, comparison of one group status at two or more point in time. So before and after. So this is the time that you will be using t-test for paired samples. Comparison of one group status under different circumstances. Okay, so this is also possible. Another example of quantitative research design. Okay, so in this particular scenario, an example of statistical design that can be used in this research design is the repeated measures ANOVA. Okay, comparison based on relative ranking. This is also possible. And comparison with others that sometimes you are comparing a certain cohort population with a cohort control as well. So that could also be possible. So when we say if you are comparing more than two groups, so it's actually one-way ANOVA. There are actually two types of comparison that you are doing. So you are comparing between subject design. So let's say, for example, you have three groups: Group A, Group B, and Group C. So you are comparing the population in Group A, Group B, and Group C. So between A and B, B and C, A and C. That is an example of between subject design. But if you have three groups and you are comparing population within Group A, that is what you call the within subject design. Okay? So another factor that we have to consider in quantitative research design would be the research location. Okay, the site location. So appropriate things that we have to consider would be the research questions that we are going to use. This would include the participants and the number, the methodologic requirements, and the role, your particular role as a researcher. So if you are doing, for example, a qualitative study, for example, an ethnographic study, wherein the environment would play a very important role, then it is also important that you do site visit. Okay, so that you'll be able to gain access and gain trust of the gatekeepers or those major stakeholders in that particular community. So information that you may want to get would include, of course, the research purpose, the rationale why you have chosen the sites, what are your expectations, and very important, the ethical guidelines, and what would be the benefits to your research respondents. Okay, in the time when it comes to time frame of data collection, um, we can have several methods of data collection considering the time frame. So when you say cross-sectional study, it involves only data collection at one point in time, meaning you will be collecting all of the information at one point only. So that's what you call a cross-sectional study. Okay? So there is a variation of that. That is the cohort comparison design. So when you say cohort, cohort refers to a specific group of population that would have a common description. Okay? Now, when you say longitudinal data collection means it involves data collection at two or more points over an extended period of time. So it could be time-related process or time sequences, or you compare your population over time. And since you are collecting data at two or more points over an extended period of time, it is very important that you'll have here an enhanced research control. Okay, so in longitudinal studies, you can do the trend studies, meaning same sample from one population over a period of time. Panel studies, same people at different times. Follow-up studies with specified condition or intervention. So you do another data collection after you have given, for example, the intervention. Okay. So in time frame variables, you can either have the retrospective design and the other one is the prospective design. So when you say retro, so the keyword here is past. Okay? So it says here retrospective design is a collection of data about an outcome in the present and about the possible causes or antecedents in the past. So you're collecting today because of what had happened in the past. So that's an example of retrospective design. Unlike in prospective design, you have an information about a cause or antecedent first. So you have the information now at this point in time, and then subsequently you collect information about the outcomes. So for example, you have a population now, okay, that has been exposed to radiation now, although I'm not saying that you can do this as part of the research. So let's say hypothetically that a certain community got, or a certain, your experimental animal got exposed to something today, and then you follow up in time, and see what will be the effect of that particular exposure. So the element of time, meaning to say, let's say after a week you do data collection, or after 2 weeks you do data collection. So that is an example of prospective design. Okay, so actually, experiment, because your quantitative study is quite expensive. So it's very important that we can have first the small scale version or the trial run design to test methods to be used in the parent study. So we call it the pilot study or feasibility study. So before you do the full scale of your research design, why don't you try it first and see if your methodology will work before actually doing it? Because, well, in our profession, experimental quantitative design would really be very expensive. Okay, so this is the end of the first part of quantitative research design. Be sure that to answer the exercises included in this particular module. That would be all for this part of the module. Stay safe and God bless everyone.